One thing that I have a lot of men say when they come in, they say, well, I'm just so stressed. If it wasn't for the stress, I don't know what I'm going to do. It'll be over soon, but if I didn't have this stress, I'd be okay. Can you speak to that?
Sure. I mean, it's a big topic that comes up in work with men. I mean, for a lot of men, it's a badge of honor. They say, look, I'm so stressed out, and like, hey, look at me. Like, I'm 80 hours a week at work, kids, you name it. So they've got things stacked on really high. Their stress levels are really off the charts. And sometimes it's difficult because where they see problematic stress is really almost when it's almost terminal. You know, their 8 or 9 could be, you know, off the charts for somebody else. You know, their 8 or 9.
So they see that as normal.
Sure, absolutely. So what their normal level of stress is typically off the charts for somebody else. So it comes, a lot of psychoeducation has to happen to inform them the effects on the body, on the mind, the relationships, and to get them in touch with the actual collateral damage of all the stress. And you know, one method that's very powerful is having a mindfulness practice.
Oh, please explain what mindfulness
Sure.
is, because we hear a lot about that these days.
Sure, and it's a buzzword, but you know, this is really, it draws upon 2,500 years of knowledge and wisdom, you know, from Buddhist psychology. And what it does is it helps the person to really develop non-judgmental present time awareness. And through the practices of the meditation and the metta, the loving kindness, you're getting more in touch with emotions, and you're getting in touch with the body, and you're actually able to figure out what's happening. You're actually able to have some stillness, because a lot of what the workaholism and the stress is an avoidance strategy. A lot of the men are constantly busy. You know, they've got a lot of projects going. They're not allowing themselves to be still, to actually feel what's happening spiritually, emotionally, and they don't want to get into their body.
Okay.
So with the mindfulness practice, there's elements of somatic, you know, psychology as well, you know, where you're able to really track, you know, the physicality of what's happening, where the specific emotions lie, how they're feeling, and how do they even know they're feeling certain emotions. And through the mindfulness practice, we can tap into that and allow the body's natural healing process to move forward.
So you have them listen to their body to get to what they're feeling.
Absolutely. Like, you know, Bessel van der Kolk, the trauma specialist, talks about the body keeps score. So all these experiences are somatically locked in the body. So with the mindfulness practice, we can actually go in there together in a relational way, and we can actually start to work through and let the body's natural healing process begin.